Today we're going to talk about the menstrual cycle. Even though it's named after menstruation or bleeding, the menstrual cycle is centered around the event of ovulation. That's why the menstrual cycle, which averages 28 days in most women, is divided into the first half before ovulation, called the follicular phase, and the second half after ovulation, called the luteal phase. Hormones are changing on a daily basis, and it can seem confusing to understand how they all fit together. So let's break down each of these phases to better understand what's going on in a unique way in each woman every day of the month. The follicular phase is named after the growing follicles in the ovary. So every woman is born with millions of follicles in each ovary. And every month, a couple of them start to grow and develop. One of them will eventually become the dominant follicle, destined for ovulation, and it starts to make very high levels of estrogen. This estrogen causes the lining of the uterus to grow thick, much like a framing of a house under construction. The high estrogen also acts on the cervix to make a characteristic type of a fluid or mucus right before ovulation that is stretchy, clear, with a slippery sensation. Once the dominant follicle is ready to release the egg with ovulation, the high levels of estrogen that it's making travel through the blood to a part of the brain called the pituitary gland. The pituitary gland senses these high levels of estrogen and in response makes a hormone called LH, or luteinizing hormone. Luteinizing hormone travels back down to the ovary to trigger ovulation. These high levels of LH made by the pituitary gland can be detected in a woman's urine using ovulation prediction kits. Once the LH surges, the estrogen levels start to fall and ovulation takes place. The luteal phase is named after the corpus luteum. Remember that dominant follicle that released the egg with ovulation? Well, that dominant follicle transforms into the corpus luteum, whose main job it is to make a new hormone called progesterone, pro-gestation or pro-pregnancy. Progesterone has several effects on the body. Number one, it acts on the cervix to dry up that stretchy, clear, slippery mucus that characterized the high estrogen levels around ovulation. Number two, it increases a woman's body temperature, which she might not feel, but if she has a sensitive thermometer, will be able to detect. And number three, the progesterone matures the lining to prepare the uterus for possible implantation of an embryo. So if you remember that estrogen was like thickened the lining, was like framing a house in construction, the role of progesterone is to put in the plumbing, put in the electrical and the drywall so the house is ready for a baby if it's coming. So if the egg released by the dominant follicle meets a sperm, fertilization occurs, then the new life travels through the fallopian tubes and 7 to 10 days later lands in the uterus and implants into the uterus. The embryo now makes a hormone called HCG that keeps the corpus luteum going and the progesterone levels rising until the placenta can form at around 9 weeks gestation. If there's no fertilization and no implantation and no HCG, then the corpus luteum starts to degrade. Overall, the lifespan of the corpus luteum is around 14 days. And so as it degrades, the progesterone levels fall. That causes the arteries in the uterus to contract and to shed the lining that was built up in the follicular phase. And so menstruation begins. We've walked through the different phases of the menstrual cycle, starting with the follicular phase as the few follicles start to grow and one eventually becomes the dominant follicle that makes high levels of estrogen that sends the signal to the brain to trigger ovulation. Once ovulation takes place, the follicle becomes the corpus luteum, which now makes progesterone to get the lining ready for implantation. If there's no implantation, the corpus luteum recedes, progesterone levels fall, and the lining of the uterus is shed through menstruation. So this whole menstrual cycle centers around ovulation, and every day these hormones are changing in this masterful display of reproductive health.